Hello, everyone. Welcome to my podcast at Real Talks with Charlotte. So, the podcast where we dwell into the real experiences of new mothers. I am a new mother and I have so many experiences to share. And today we're focusing on the postpartum period, a time filled with joy, challenges, and profound transformation. We'll explore common concerns after pregnancy, share coping mechanisms like coping strategies, and about some experts read that research that I've done to support us in this journey, and we could also talk about any more questions, and I'm actually gonna talk about some questions that people have, and answer them based on my research that I've done. So here, like, what is like understanding postpartum is a challenge, right? So what are the most common physical and emotional challenges women face after childbirth? What is it? So, postpartum challenges encompass both physical and emotional aspects. Physically, women may experience a vaginal soreness, breast discomfort, fatigue, and challenges in bowel habits. Emotionally, it may encounter like mood swings, anxiety, and feeling of overwhelm. So, how prevalent is postpartum depression, and how does it differ from the baby blues? So, this is one of the questions that I will talk about that have been frequently asked. Now, postpartum depression affects approximately 15% of new mothers. Unlike the baby blues, which involve mild mood swings and typically resolve within 2 weeks. So postpartum depression is more severe and persistent. Often it requires professional treatment as well. And many of us like don't understand that part because we think, you know what? It just mood, it's gonna go away. But no, it gets worse over time. So we'll always might even need treatment for it. So the next concern is what are some signs that indicate a new mother should seek medical attention? I've had many signs as well, which I might talk about in my other videos. Um, so please keep an eye on for those videos as well. But right now, I'm just going to discuss the questions and answer, give you the answers of the one that I researched. So, what are some signs that indicate a new mother should seek medical attention? Is one of the questions frequently asked. So, a warning signs include persistent sadness. You'll see the mothers being always sad, difficulty bonding with their kids, babies. You might see, they might even feel, the mothers themselves might feel that, oh my God, I'm not doing justice with my kid. But again, they do not find that bond. They cannot find that, gap, right? They can't try to fill that gap. So extreme fatigue, you'll feel bloated all the time, you'll feel tired all the time, and thoughts of like self-harm. You feel like you want to self-harm yourself. Physical symptoms like excessive bleeding. You'll have excessive bleeding, especially in the beginning, right? You're going to have excessive bleeding, severe pain, abdomen pain, or signs of infection, warrant immediate medical conditions. So these are like the ones that immediately you need support with is any some sort of infection that needs to be dealt right away. Now, what are the coping mechanisms and what are the support? Now, not every one of us finds the support that we actually need, right? Now, one of the questions frequently asked is what coping strategies can help manage postpartum stress and anxiety? And the answer to this is effective strategies include activity such as a support network. right? Like, you established a network of friends, mainly family, friends, and friends who are like family, and practicing self-care, right? You want to take care of yourself as much as possible because if you take care of yourself, then you're able to take care of your baby and, others, mainly your baby, because that's, if you can't take of your care of yourself, then, you are not able to take care of your baby as well. So engaging in light physical activity, go out for walks, take the baby along with, keep your mind clear, and seeking professional counseling when needed, like mindfulness and relaxation techniques that also can elevate, your mood and alleviate stress, right? Or reduce your stress. So the next question is, how important is partner and family support during the postpartum period? The answer to this is support from family and friends is crucial, is very crucial. Actually, I would say from family is crucial, right? And emotional and practical assistance, especially, um, it can significantly reduce the risk of a postpartum depression and aid in the mother's recovery process. And even that could help the mother recovering faster, right? Sometimes, especially after cesarean C-section, your recovery time, they say 6 to 8 weeks. I think it's more actually, but if you're not able to take care of someone's not there all the time to take care of your baby and you're not able to recover faster and hence not able to deal with all the problems or your kids or the situation you're in and you're not getting better because you're not healed properly, right? So that's very important. And are there resources available for mothers experiencing postpartum challenges? Yes, of course. There are resources, including postpartum support groups. Like, there are people who will support you with that. There are counseling services. There are educational materials provided by healthcare professionals, especially when you are in the hospital. They'll give you certain resources where you can look at and, talk about it and even call them and ask for any support, right, that you need. And organizations like Postpartum Support International offer helplines and online support. So you'll always have online materials to read from and international phone help as well that you can call them and ask if you are concerned about it. Um, Now, next question we're going to talk about is what do healthcare professionals recommend for postpartum care? Now, after a little bit of my research, what I've learned, healthcare providers, they emphasize the importance of postpartum checkups. Always do your routine checks, typically within 6 weeks after delivery. That's very important. They recommend monitoring physical recovery, mental health, and providing guidance on nutrition. It's very important. Nutrition is very, very important for yourself, your baby, exercise, and family planning. So they give you all these assistance and help so you can deal with it. Okay. The next question is how can physical therapy aid in postpartum recovery? Now, postpartum physical therapy, it can address issues like pelvic floor dysfunction, right? Because that's very important. If you want to further look into it, that would be really great. Or follow me for more information on my videos about pelvic floor dysfunction, back pain, and incontinence. So, therapists tailor exercises for you specifically just to strengthen your muscles and improve overall function, facilitating a smooth recovery. Of course, in my other video, I'll talk more about my recovery and my story, how I dealt with postpartum depression and how I went through, my pain and my whole journey will be all given to you on my next video. But thank you so much today for listening to me, and thank you for joining us on this segment of my Real Talks with Charlotte. Remember, the postpartum period is a unique journey, though, for every mother, and so was it for me as well, filled with its own set of challenges and triumphs. So, seeking support and understanding yourself that you're not alone. Okay. And that can make a huge difference. It can make all the difference, actually, to be honest. Stay tuned for our next episode and where we'll continue to explore topics that matter to new parents, to families in relationships, in love, before marriage, after marriage. So stay tuned. Bye bye. See you later.